Assalamualaikum. Now settle down quickly, please. We are about to start. Turn it off, please. Today is my last lecture in this course. We'll discuss anti-helminthic drugs. The last lecture is the antimicrobial drugs. Anti-helminthic drugs are the drugs which eliminate the worms from the body. Worms. Worms infection are very, very common. You would be surprised to know that 1/3 of the people in the world, 1/3, not only schistosomiasis, for many, on average 1/3 of the people in the world, they are infected with worms. But most of the time, the infections are asymptomatic. They do not cause any problem. They create some symbiotic relationship within the host. And we do not become aware in more than 90% of the cases. So we do not know. When there are some symptoms, then we can know that there is some infestation. Then that person needs treatment. Otherwise, it is highly likely that many of us within this classroom may be harboring some worms in our body, mostly in the intestine, and we do not know. It is ugly situation. Worms inside our body, and also coupled with bacteria on our surfaces, in our mouth, on our skin, in the GIT. Many of you might be harboring lice in your head, in here. Lice, worms, you must be lice, not worms. So human is ugly. Huh? Microorganisms, worms, and lice. Whatever we do, we look beautiful, we wash everything, but our body is infested with so many microorganisms, inside and outside, everywhere. What we will discuss today, please keep quiet, we have to finish the lecture on time. Just like antiviral and antiprotozoal drugs, we will classify the drugs based on the activity against which they are effective, against which worm they are effective. Please, go ahead. And we'll describe the mechanism of action, clinical uses, and important adverse effects of. The important, we are not going to discuss all, there are many. Important anti-helminthic drugs. Now I want to share with you one thing important. That for all other drugs, I studied pharmacology while I was studying MBBS in 1987. 25 years later. Believe me, this is the only area of pharmacology the drugs which we studied during my undergraduate days, they are the same, which I am teaching. For the rest of the drugs, more than half of the drugs which we studied are no more. And more than half of the drugs which I am teaching now, we didn't study in my undergraduate. So the pharmacology is a very dynamic subject. It is continuously changing, except this year, the same drugs which I studied, I am teaching now. Didn't change. None of the drugs. They are all older drugs. Okay, anti-helminthic drugs. They either expel worms from the GIT or eradicate adult helminths in the developmental form. As with antibiotics, the anti-helminthic drugs are aimed at metabolic targets that are present in the parasite but are either absent or have different characteristics in the host or human cell. Again, the concept of selective toxicity. The drugs should be toxic to the worm but not toxic to the host cell. Now, types of worm. Did you do parasitology in microbiology course? Yes. So you have some basic idea about worms. So worms are classified into three: nematodes. Those are rounded shaped, cylindrical shaped. They are round with complete digestive system starting from the bowel and anus. There is a complete digestive system. They are roundworms or nematodes. Enterogus vermiculus. Pinworms, small, this is the most common infection in the third world. Pinworms, very small, needle-like worms coming out from the intestine in the form of bunch, hundreds to thousands of worms together. Please, if you have any question, ask me. Instead of asking each other.
He was asking, there's a worm which is studied microbiology.
Yes.
Thank you, sir.
Which is?
Yeah, that it in children that it comes out of the anus at night and then the child scratches.
That is enterogus vermiculus. So instead of discussing with each other, direct the question to the whole class, everybody should know. You both of you are always engaged in class conversation. Ascaris lubricates, which are common. Ankylostoma and Necator species, these are the hookworms. Hookworms, why we call them hookworms? Because they attach together with a hook. They attach. Just like they are eating, they are biting. Just like bite-like structure, teeth-like structure, in the shape of hook, and they attach. And these are the only ones which suck blood and cause chronic iron deficiency animals. Hookworms. Stump-like stumporals, same worm, just like thread. So few common. Tissue nematodes are the ones whereby adults as well as larval form, they harbor not only the intestine but somewhere in the systemic tissues inside the body. And some of them are onchocerca and filaria. These are nematodes, roundworms, but they predilections. These are intestinal and these are tissue. And then we have nematodes, flukes, leaf-like structures. And we have schistosoma, many species, Clonox sinensis, and Paragonibus mestermani. There is a lung fluke. That influences the lungs, there is portal circulation and in the tissues. So these are the flukes. And the last is festodes. The common word is tapeworm. Why we call them tapeworms? Because they are flat.
Very long.
Not necessarily long. They are tape-like, flat. Their tinea saginata is very, very long. But tinea solium is not very long. Diphyllobothrium latum, which is obtained from the fish tapeworm, which is small, shorter. So they can be shorter, they can be longer, but the characteristic is they are flat, very flat. So tinea saginata, which is the longest, beef tapeworm, tinea folium, pork tapeworm, diphyllobothrium datum, fish tapeworm. This is quite similar, and this is also similar to Echinococcus granulosus, dark tapeworm. This is also similar in size. Tinea saginata is the biggest. It can be many meters, several meters long. This is Ascaris lubricate, and they can cause. There are so many. Sometimes there are so many hundreds together. Ascaris lubricate. They are even causing the bunch of Ascaris lubricate intrawoven together. They can cause intestinal obstruction. Now, the drugs, according to the classification of the work, the drugs are classified accordingly. If you are not interested, you can leave. According to the type of worm affected by the drugs are classified as anti-nematodes. We'll discuss all those anti-trematodes and anti-cestodes. You will see two drugs, the same drugs, anti-trematodes, and the sequence is changed. So that here the drug of choice for cestodes, the alternative drug, glucosamide. For cestodes, the drug of choice, alternative drug. So the character changes. The drug has. Now the most important and widely used drugs for nematodes, roundworm, is there are three drugs in this class: benzimidazoles, mebendazole, thiopentazole, albendazole. As far as the mechanism of action is concerned, they are the same. But there are certain different properties we will discuss in the differential comparative. We will do comparative analysis. But basically, the mechanism of action is same. But they may not belong to the same class.
What is azole mean? What is azole mean?
Chemical structure, just like benzene, there is a ring, azole ring. Is there a structure? But based on the chemical structure, they are not chemical.
And special chemical structure like attack certain things and even the other drugs.
Exactly. Then chemical structure, which defines the shape of the drug, confirms the pharmacological activity. Okay? So, mechanism of action, if you remember, we discussed one of the antifungal drugs, glycopyrrolate. Do you remember? Do you remember the mechanism of action for one? Glycopyrrolate, as an antifungal drug, we discussed these azoles. They share the same mechanism of action with antifungal glycopyrrolate. That is okay. Now once again I ask you, what is tubulin? Microtubule. Microtubule. Organs of locomotion for the worm. Mitosis in unicellular. In unicellular organisms. But then when the organism is multicellular, those microtubules are used for locomotion. They do not have bones and muscles, skeletal muscles, but microtubules affect polymerization and depolymerization of microtubules causes the movement of the organism from one place to another. So this is just like bone and muscles of the worm. Those microtubules are made of the polymerization of beta tubulin protein. Beta tubulin proteins. Now what happens? That benzimidazoles, they inhibit the polymerization of beta tubulin, resulting in the decreased synthesis of microtubules. So once the microtubules are not properly polymerized, that means the locomotor function of the worm is lost. The worm does not jump, but it becomes immotile, paralyzed. Because the microtubules are not working, the worm cannot now Now, have you thought of